you can prevent constipation. If you are suffering from mild constipation, a few easy lifestyle changes can help manage the condition. Worry not, these are nothing major. But if your constipation is a problem, you need to see your doctor, or at least discuss it with a pharmacist. Here are some constipation prevention tips. Are you, or a person you know, constipated? You cannot poo. Technically it means people have difficulty opening their bowels. In the United Kingdom alone, constipation affects about 1 in 7 people that could be deemed otherwise healthy. The two main groups that are affected by constipation are young women and the elderly. It especially affects those who regularly take medicines. We will look at the symptoms next, but it is important to explain that constipation is a common issue, yet only 3 of adults have it persistently for over 20 years. If you suffer from constipation, it does not generally mean that there is something seriously wrong. In most cases constipation symptoms are temporary, and they will clear up after simple lifestyle interventions. How do you know if you are constipated? If you are opening your bowels less than 3 times a week. If you need to strain, you are in pain and you need to force your bowels to open on more than a quarter of occasions. If you pass a hard, dry, or lumpy pellet like stool on more than a quarter of occasions. If you feel you have not finished doing a poo, yet nothing is coming out. Needing to use manual maneuvers to achieve bowel emptying. One or more of the above symptoms may mean that you are constipated. If you have a pain in your stomach, constipation may be part of irritable bowel syndrome. This is often called IBS. Abdominal bloating is often part of many bowel complaints, including constipation. If you are a carer for someone suffering with dementia or other mental health issues, constipation could easily be missed. Changes in their behavior may be a good indication, such as clues that they might be in pain or discomfort. Although it is not always that easy, a person with dementia may not be able to explain that they have a problem doing a poo, or they may not even be aware that there is a problem. It is not a good idea to use any form of laxatives too often with elderly people who are suffering from dementia. One reason is that people with dementia may find the experience of rushing to the toilet, or indeed having an accident, very undignified and embarrassing. No different than with people who do not have dementia really. There is also the risk of unpleasant side effects. Laxatives themselves, by their very nature, can cause stomach pains, loss of appetite. In some cases, this can aggravate the problem even more. As a carer, it may be necessary for you to look out for the signs of constipation, and the reality is that old saying, prevention is better than cure. So, how can we try to prevent constipation from occurring in the first place? What causes constipation? Firstly, it is important to say that there may be no real obvious reason as to the cause of constipation, but on the other hand, there are many possible causes in adults. So, we will look at the most common. The most common causes of constipation include being inactive and not exercising, changing your diet or daily routine, delaying or ignoring the urge to go to the toilet, not drinking enough fluids, not eating enough fiber. More on that later. Not moving around sufficiently, as well as spending too much time sitting or lying in bed. Side effects of medicines, stress, anxiety, or depression. So, taking all that into consideration, constipation can be caused not just by poor diet but also by more serious disorders. It all depends on how our bodies operate, or indeed, how we operate our bodies. The causes of constipation fall into 3 categories. 1. Slow transit. This is when our stool poo does not travel through our digestive tract fast enough. Risk factors for slow transit include a low-fiber diet, dehydration, and taking certain drugs, such as opioid pain medication or antidepressants. Another potential cause of constipation is cancer or intestinal stricture, which is a narrowing in the intestine that makes it difficult for food to pass through. 2. Nerve signaling problems. Nerve problems can impair the journey of stools through the digestive tract. So, patients with Parkinson's disease and multiple sclerosis can suffer with constipation. 3. Pelvic floor dysfunction. This is the inability to properly relax and coordinate your pelvic floor muscles in order to have a bowel movement. That is doing a poo. You can prevent constipation. If you are suffering from mild constipation, a few easy lifestyle changes can help manage the condition. Worry not, these are nothing major. But if your constipation is a problem, you need to see your doctor, or at least discuss it with a pharmacist. Here are some constipation prevention tips. The top foods to help with constipation or indeed to prevent it are a medium-sized apple with the skin on, artichoke, citrus fruits, chia seeds, figs, Jerusalem artichoke and chicory, kefir, kiwi fruit, legumes such as beans, peas, and lentils, oat bran, pear, prunes. These are historically used as a natural remedy for constipation. Rhubarb, spinach and other greens, sweet potato, whole grain rye bread. These all help to improve your gut function. Remember though, if you have IBS, avoid or reduce high fructose fruits, such as apples, pears and watermelon. So, in summary, eat food that is high in fiber. Get more exercise. Regular exercise can help stools move through the colon. Drink more water, aim for 8 glasses per day, but avoid caffeine, as it can dehydrate you. Do a poo when you feel like it, as you feel the urges to go. Do not wait. Constipation and pregnancy. Constipation is quite common during pregnancy and for 6 weeks after giving birth. If you are pregnant, you have probably experienced those signs of constipation. We can blame hormonal changes, pressure on the womb, and the iron in prenatal vitamins as a rule. An increase in the progesterone hormone during pregnancy causes the relaxation of the body's muscles. This also includes your intestines. Slower moving intestines would mean slower digestion will follow, and this can lead to constipation. Although there is a massive choice from over-the-counter pills, as well as natural cures and home remedies, where pregnancy is concerned, the number of solutions is dramatically reduced. The following remedies are pregnancy safe. A high-fiber diet will supply pregnant women with vitamins and antioxidants. It also helps prevent constipation. Pregnant women should try to consume 25 to 30 grams of dietary fiber on a daily basis to stay regular and healthy. This include fresh fruits, vegetables, beans, peas, lentils, bran cereals, prunes, and whole grain bread. Pregnant women should drink at least 8 half-pint glasses of water per day. It sounds a lot, but it will help to keep their stools soft and moving smoothly through their digestive tract. To help with lightening the burden on your digestive system and to help with constipation relief, it is a good idea to break up your daily food intake into 5 or 6 smaller meals. This method allows your stomach to digest food much easier without the effort of having to work overtime and allow it to transfer food to the intestine and colon much more smoothly. The problem with eating large meals is that it is easier to overload the stomach and make it harder for your digestive system to process the food that you have consumed. I hope you have enjoyed this video. There are other videos that I have produced in Mrs. Shilling's Emporium. My daughter, Penny Shilling, has produced her own video on natural teeth whitening methods. My son, Bob Shilling, has produced a video on washing a car using natural products. I have produced a video on curing toothache using natural products that you can find in your kitchen. If you would like to watch more of our videos, please click on the subscribe button below.